Hello, I'm Dr. Jeffrey DeSarbo. I'm the medical director of ED 180. I'm also a psychiatrist specializing in the treatment of eating disorders here in Long Island, New York. Thank you to those who've turned in for this video. I hope that you can utilize what you'll see here to improve your surveillance, your care, and the treatment of patients with eating disorders. I created this short presentation to hit the key points that may be of interest when it comes to treating patients with eating disorders, especially anorexia nervosa and COVID-19. Let's get started. So to begin, there's really a lack of research with eating disorders and infections, especially when it comes to outbreaks. So turning to the literature to see kind of what to look for in our patients and what to do through the published literature is not the most helpful thing. The articles are kind of spread out over time, over decades, across multiple different types of journals, and there's different results that the articles come to as far as their conclusions. But there is a lot of helpful information that if you put it all together and try to make some sense of it, it can be put into a context that I think can help us with treating our patients. Now, I essentially started to look at the research on infection and immunity after many patients were asking me questions with COVID-19, and their families had a lot of questions. Clinicians were asking me about it. I started speaking with other physicians and other clinicians and experts in the field. I learned there's very little consensus amongst everybody about the conclusions, and that most of these conclusions came from personal experience or just general opinions using common sense that they thought was made a lot of sense, but not necessarily on the published research. And again, like I said, it's hard to find good research if it's spread out. So many people may use common sense. They'll say, well, when working with patients with anorexia nervosa, we need to be careful because they're malnourished. That can lead to immunocompromised states. They might be at an increased risk of infections and complications. Other physicians have said, well, if you look at clinical experience, you don't see a lot of infections in people with eating disorders and anorexia nervosa especially, and they can sometimes say, I've read studies and it shows that patients with anorexia nervosa are at decreased risk and even resistance to infection, and very few people were kind of saying, well, I think it's about the same risk. So my first question that I really wanted to know based on the research that's out there is, what is the risk to our patients when it comes to infection? So I first looked at that train of thought where there's decreased infections in anorexia nervosa. And there's multiple citations throughout many journals that say patients seem to have a decreased risk for infections with anorexia nervosa. And what I noticed was all of these papers over and over were citing the same source. And it's the source that I have right here that was in 1981. And it had a subject population of 9 patients, so it had a very low N. And in this paper, it even quotes, it says, patients with anorexia nervosa are exceptionally free from infectious diseases. So this impression kind of got passed around from one article to the next and quoted. So some people came away with the general impression, well, that must be accepted as fact because it's cited in so many different journals. But if you look at the other journals that are out there, and I just put a couple of them right here, there's bigger N's. There's studies that both preceded this article and have come after it. And their general conclusions is the rates of infections for patients with anorexia nervosa is about the same as the general population. Now, I did want to look at one study in particular because this had it looked at over, well, close to 1,600 patients with eating disorders that were admitted at the eating disorder unit at Helsinki, and this was between the years of 2000 and 2010. That was compared to over 6,000 general controls. And what they looked at is, of these patients coming into the hospital, how many of them were on antimicrobial treatment, antibacterials, antifungals, antivirals. And they noticed that with binge eating disorder and bulimia nervosa, there was a higher rate of people who were being prescribed these medications that were being admitted compared to the general population. Also, that was true with males with anorexia nervosa. However, the study also showed there was no statistical difference with women with anorexia nervosa as to how much medication, antimicrobials they were being prescribed compared to the matched population controls. So again, a little more, another way to look at, I should say, evidence as to rates of infections and infections being treated. So one of the key points and take-home messages, I think it's relatively safe to assume at this point, as when it comes to anorexia nervosa, especially, the risk for infections are about the same as the general population. The studies don't really say that there is a increased risk for infections, and there's little support that there's decreased risk of infections. When it does come to bulimia nervosa and binge eating disorder, that one study that I just quoted showed that they were often being treated at a higher rate for infectious processes. So there may be a slight increase of risk. What the researchers believe with those two conditions is there may be some higher BMIs, there may be more patients that have comorbid conditions such as hyperglycemia, hypertension, diabetes, and cardiovascular disease that make their risk for infections even greater. Now I want to address that population that often says, well, we don't see a lot of patients that look sick with infections with anorexia nervosa. And sometimes that may be just because their clinical presentation of anorexia nervosa is something that gets taken for granted, maybe. But when you look at anorexia nervosa and COVID-19, there is a great overlap of types of presentations, and it's important for the clinician here to be able to differentiate the fine aspects of how they present clinically. For instance, one thing, and I'll get to the next slide, which shows there's really no significant fever response that you'll see in patients who are infected with anorexia nervosa. People with COVID-19, of course, that's one of the key factors, is looking for a fever, and that also comes with chills. Whereas with anorexia nervosa, people often report a cold intolerance, wearing multiple layers, covering with blankets. So even looking for, if you see somebody presenting that appears to have a cold intolerance, you want to kind of ask, are they actually having chills? Is this something different? With anorexia nervosa, they're lightheaded, they're dizzy, there can be chest tightness. This is all similar, again, to what you might see with COVID-19. Now there's, anorexia nervosa, there's often a lack of desire to eat, and that there's that fear of food, that fear of weight gain, whereas with COVID-19, there's often a loss of appetite, and many people are reporting a loss of smell and taste as well. That myalgia, there's also muscle aches and pains and fatigue with anorexia nervosa. Many people with eating disorders have GI complaints. It's pretty common. With COVID-19, the GI symptoms are kind of rare. And with both anorexia nervosa patients that have infections, they can and usually do present as asymptomatic, whereas COVID-19 patients can be infected and also present as asymptomatic. So what we need to look at is some other factors as well. And again, this is a big finding here that in this study, and it's been kind of documented in other studies too, that there seems to be a lack of fever response in anorexia nervosa. Now it's not just also a delayed response, but it can be totally absent. And when we're looking at something with surveillance of COVID-19, and we're really looking for a fever as a key factor for trying to make a diagnosis, sending people for testing in our patient population, that can be missing, and people will not be sent for testing, and a lot of the symptoms that they may have may not be looked at as an infectious process, and as I mentioned in the prior slide, looked at as findings that are related to their anorexia nervosa. So this study, again, had 311 patients, I think, and it's pretty consistent that Some people have a lower core body temperature to begin with, and you might want to look for any changes in that core body temperature, but certainly trying to look for the temperature parameters currently set by the CDC. It may not be there. When you look at blood work too, you're going to find that leukocyte counts, white blood cell counts are pretty much low across the board. The pancytopenia is common, so you have decreased white blood cells, neutrophils, lymphocytes, monocytes. And this seems to be related to bone marrow changes that take place in about half the patients who do have anorexia nervosa. But because of these low and normal leukocyte counts, it may also at times just not present a red flag for infections. And again, kind of gives some people the impression that the person is not infected with any type of infectious process. So when you take everything together, symptoms of anorexia and COVID-19, no fever response, abnormal blood work, patients, at least initially, can often appear asymptomatic. But if COVID positive patients are not detected, it's possible that they can, down the road, especially if anorexia nervosa worsens, have significant complications, and we'll discuss that a little bit later. But because of this asymptomatic presentation, it is important for clinicians out there to have a slightly elevated level of hypervigilance, trying to differentiate symptoms of anorexia nervosa with potential symptoms of infection and taking the necessary precautions of protecting the patient and staff. This whole next section I'm going to go through quickly. I have more detail in the paper that I wrote on this topic, but I'm not an immunologist, but I think everyone always needs some clarification at times of what's going on with COVID-19. Now, the virus itself is SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. Now, that's the virus. When it infects a person, the disease process is the COVID-19. It kind of goes, it's a respiratory illness, so it enters through when people inhale the virus most of the time. It goes through the ACE2 receptor cells. That's the target cell that it's looking for, and eventually it's going to end up trying to get into the alveolar parts of the lung, the little air sacs at the end that are responsible for exchanging oxygen to the red blood cells. The thing that happens with this is the disease causes a thickening of the walls of the alveolar, and it makes it very difficult and eventually impossible for the lungs to oxygenate the blood, and that's where you get this severe respiratory illness from, which often requires the vent support. Now, if you want to know more on that, I did include, there's a YouTube video, COVID-19 Can Kill, by a pathologist that kind of gets into a little bit more of a descriptive process of what takes place and why so many people have difficulty breathing. But just wanted to clarify exactly what we're looking at. Now, the immune system really consists of two components, and there's even more to that. It's cell-mediated and the humoral immune system. There's different parts of that. Again, I'm not going to go into the details. Humoral is more of your antibodies that the body produces to help fight the disease process. Your cell-mediated involves phagocytes and cytokines and cytotoxic cells that help battle infections. I'm just going to mention here, again, some of the similarities of what the findings are with anorexia nervosa and COVID-19. Now, I'm not an immunologist, and the immune response alone is extremely complicated and not fully understood, especially in both of these conditions. So I'm just going to be brief to the point and just point out that there's some common findings that may keep immunity intact and at times potentially increase with infections. Here, there's findings of increased interleukin-6 and tumor necrosis factor alpha, both pro-inflammatory cytokines. They're elevated in anorexia nervosa, and they're also elevated with COVID-19. Likewise, there's an increase in the antigen-presenting CD4 positive T cells, and there's a decrease in the natural killer CD8 positive T cells. And this is both seen in anorexia nervosa and COVID-19. Now, I'm not making any direct assumptions on this or trying to imply anything. I'll leave that to the immunologists for possible cause and effect connections of how these two things in both anorexia nervosa and COVID-19 together may complicate the picture. But the take-home message that when you go through the research and especially with immunity is that the cell-mediated immunity in patients with anorexia nervosa remains relatively intact, which surprises many people. They think, well, because they're malnutritioned and everything, their body weights, their BMIs are so low, they must be immunocompromised. That's not necessarily the case. Now, many studies do say there are clear significant differences. Some define this as there are changes with anorexia nervosa to immunity and the immune system. Some say it's a dysfunction. Some do speak of it as a compromised system. However, most people do agree in the end that the cell-mediated immunity remains relatively intact despite the malnutrition. So, of course, how can this be? That's one of the big questions. So the research kind of shows that there's this difference between the type of malnutrition you have with anorexia nervosa compared to protein energy malnutrition, which is more typical type of starvation, lack of food type of malnutrition. So with the more typical protein energy malnutrition, there's more of a loss of protein across the board. Caloric deficiency takes place as opposed to anorexia nervosa, which often is more restrictions of carbohydrates, and protein is spared more compared to the protein energy malnutrition. And that seems to be, that protein sparing component seems to be the thing that helps maintain the immune system. So trying to make sense as to why are people, they are immunocompromised with more of a protein energy malnutrition, but why aren't they with anorexia nervosa malnutrition? Most of the studies point to this fact. Now, there's also a lot of studies out there that show that the immune system functioning, whether it's changes, dysfunction, or compromise, they return to normal parameters with refeeding with anorexia nervosa. So kind of here, this slide kind of indicates that, that common saying that all the time we say, what's your key medicine? It's vitamin F, the food. It is. And the studies show that, with refeeding, people tend to have a return to a more normal functioning immune system. It always, one of the things with refeeding too is that fever, that delayed fever response that I spoke of earlier. The fever response seems to also return with refeeding and with recovery. So especially when patients are not in the recovery process with anorexia nervosa or are worsening in symptoms, that fever response remains to be a problem. So what we look at here is even though there's not this increased risk per se compared to the general population with infections, if those do get infected, morbidity and mortality seem to be increased. So especially with severe anorexia nervosa, and again, that's why paying attention to exactly where is your patient with regards to their current medical status is important here. Where severe anorexia nervosa is not clearly defined in these studies, and when we're often looking at BMIs of 17 as criteria, I think it's safe to say if we're looking at BMIs below 15, we're getting into the more serious ones, and those are the ones that could potentially have significant higher morbidity and mortality. There's more complications in their treatment, they respond slower, the death rates are higher, and this is directly related to studies in immunity that shows that the immune system becomes further compromised. So while it relatively it maintains intact with anorexia nervosa, as the disease process gets worse, it does become more and more compromised, that the immune system. So an important thing to keep out, even though the risk is there, you gotta, if they become infected, now you gotta really worry a little bit more about their complications. I just want to say here that self-care is the first thing for all the clinicians out there. Everyone from, if you're in this field and you're working, whether you're a therapist, a dietitian, physician, nurse, there's a lot of work that's going on. We're really worried about our patients. Everyone knows that. We're in this for a reason. But we also worry about our families, okay? And oftentimes you'll find the third thing we worry about is ourself, and I think it's really important for everyone to understand you do have to take care of yourself first, or you're not going to be as effective in taking care of your family and your patients. So you got to make sure you run a balanced life. If you're under extreme amount of stress, make sure you have a therapist or somebody you can talk to yourself. Consider having groups for the clinicians that you put together just to discuss coping skills and what everyone's dealing with. But you have to take care of yourself first. So just to recap the key points here, infections risk are generally the same. Again, with bulimia nervosa and binge eating disorder, if there are those comorbidities of hypertension, diabetes, cardiovascular disease, your risk can be greater. With anorexia nervosa, that fever response, it might be completely absent. It can certainly be delayed, as it usually is. So it's not the thing that we're looking for in those patients that we do in the general population. The symptoms that people with COVID-19 have can certainly mimic anorexia nervosa. So the clinician has to differentiate. And by clinician here, I'm saying whether you're a therapist, dietitian, nurse, physician, you can all try to ask these questions and communicate as a team if something seems out of the ordinary. So you have to pay some extra attention for the detection process with these patients. Generally speaking, the cell-mediated immunity remains intact with anorexia nervosa, even though they're still in a malnutrition state. It's just that there's a difference with the type of malnutrition that they have compared to other types of malnutrition and starvation. In the end, mortality and morbidity rates can be higher, especially with severe cases of anorexia nervosa or with those who have those co-occurring medical conditions. But in the same time, there's no separate guidelines for eating disorder patients. That's why all the key points above, I think it's really important. We kind of have to take that into account for ourselves while following the CDC and the WHO guidelines. But we have to pay attention to all those special considerations we discussed. So I really want to thank you for turning into this video. I hope it'll be of some help for you, some things to think about. I always feel the best clinicians are those who continually search out and want to stay informed with new information. So again, please share this with any others like yourself who can benefit from this. And finally, if you want a copy of the paper, just send me an email and I'll send you the paper, which kind of covers a lot of this, maybe a little more detail. But again, for all of you out there, I really wish you all the best to stay healthy, take care of yourselves, not to panic, but not to take things lightly. Be prudent with your decisions, both clinically and personally. But again, try to remain calm. Thank you, and I hope this was helpful.